Hello, I am Dr. Brigadier Rajeshwar Singh, Director Medical Oncology, पारस हॉस्पिटल पंचकुला। आज मैं आपके साथ ब्लड कैंसर के कुछ विचार शेयर करूंगा। Childhood cancer is a word disliked by all parents. Childhood cancers are less common as compared to adult. Out of 15 lakh new cancer patients, only 1 lakh patients are of childhood cancers. Out of them, 1/3 are childhood leukemias. Good thing about childhood cancer is that cure rates are very high. Blood cancers are basically of two types. Acute leukemia, which is very rapid in onset, and if the child is not brought to the hospital early, the child can lose life. While chronic leukemia is slow onset. There is no exact cause of childhood leukemia, but certain risk factors have been implicated, like radiation, chemicals, and pesticide. Apart from that, कुछ अनुवांशिक कारण भी होते हैं जो फैमिलीज में रन करते हैं। ब्लड जो हमारा है वो बोन मैरो के अंदर बनता है। इट कंसिस्ट ऑफ 3 important components. One is hemoglobin, which supplies oxygen to all part of body. Second is white blood cells, जो कि इन्फेक्शन से हमको बचाते हैं, और एंड थर्ड इज प्लेटलेट विच प्रिवेंट फ्रॉम ब्लीडिंग. सो व्हेन देयर इज अ abnormal growth, uncontrolled growth of white blood cell, it becomes blood cancer. Now these white blood cells not only abnormal because they can't fight infection, and at the same time they clog the bone marrow and prevents the production of hemoglobin and platelets. This results in vague symptoms in a patient. So patient is not diagnosed early. So the complaints can be in form of recurrent infections and recurrent fever because of abnormal white blood cell, anemia, fatigue because of low hemoglobin, and bleeding or red spots on skin because of low platelets. So because of this vague symptom, the child comes very late, and in acute leukemia, life can be lost. So I request all parents, if they have these symptoms, please show to their doctor very early. How do we diagnose this blood cancer? First, we do complete hemogram. This will show hemoglobin is generally low, white blood cells are either high or low, whereas platelets are also generally low. Then we do the second test, which is called as peripheral blood smear. This will tell us which type of leukemia is there, whether it is lymphoblastic leukemia or it is a myeloid leukemia. After this, based on this test, we do specific tests. The specific tests are bone marrow studies, cytogenetics, and flow cytometry. Why do we have to do this specific test? I know these tests are costly, but these are done for 2 reasons. Firstly, specific treatment is given for a specific type of blood cancer. And secondly, we risk stratify. Risk stratification का मतलब क्या है कि जिसको जितनी ट्रीटमेंट की ज़रूरत है उतनी ही देनी है, क्योंकि चाइल्डहुड ल्यूकेमिया बहुत छोटी एज में होता है एंड क्योर रेट्स आर हाई, तो children they live for very long. So we do not want the child to have late side effect in form of second malignancy in these children. So it is very important to give high dose chemo to those who are high risk, whereas low dose chemo and short chemo is given to those are low risk, so that side effects are less. So it is very important that specific treatment should be given for a specific type of leukemia. Now, what is the treatment of acute leukemias? The treatment is in form of chemotherapy, which is strong and it is a prolonged chemotherapy. And those at high risk are given bone marrow or stem cell transplant. Now, because it is a disease of blood and we have to replace all the abnormal blood and chemo is given, it cannot differentiate between the abnormal cell and normal cell, and some amount of normal cells are also killed. So there are very side effects. So we have to give a very good supportive care. Three things are very important where these. Firstly, that hospital should have a very good blood bank facilities, because repeated blood transfusion are required at a very short notice. Secondly, the family member should have good donor members so that blood can be given at a short notice. And thirdly, all family members have to contribute so that the child does not get infection at home. These things are so important, as many lives are lost if these small little things are not taken care of. So take home message in this: firstly, the child has to be brought very early to the hospital, otherwise the life can be lost. And secondly, a specific type of treatment is given for every type of blood cancer. So let's all get together to save the child from this deadly disease for the cure of leukemia, and no life should be lost at the dawn of life itself. Thank you.